I'm Julia, and this is my comparison of the healthcare systems in the U.S. and in Taiwan. So the U.S., in terms of like the type of healthcare system that it doesn't have a single type of system. It's a combination of systems. So that includes a combination of private and public. So in private basically means that it's like private insurance companies funding the healthcare. So that's either through employers, which is what most people have, or through individual plans, which is less common, but it is an option that some people use. And then about 30% of the total health insurance in the country is publicly funded, so that includes Medicare and Medicaid. So that's for people with low SES and for people over the age of 65. And this is not a universal healthcare system, so it still leaves, as of 2018, 13.7% of people are uninsured in the U.S. And then compared to Taiwan, Taiwan does have a national health insurance program, so that means universal coverage. Everybody in Taiwan has health insurance. So that is publicly financed through taxes, and although some national health insurance systems don't have copays for patients, Taiwan does have copays, but that's also something that the U.S. has. So overall, Taiwan's healthcare system covers more people and is more accessible to people. So to compare the population health of the U.S. and Taiwan, I looked at the infant mortality rates, which is often an indicator of the health of the total population as it correlates with other health measures. So the U.S. has a high infant mortality rate. It's 590 deaths per 100,000 live births, and that's as of 2016. And Taiwan's number is still fairly high, but it is lower than the U.S., so that's 430 deaths per 100,000 live births. And that indicates that, in general, the population health of Taiwan is better than that of the U.S. So I also looked at the healthcare spending per capita. The U.S. has very high healthcare spending per capita, actually highest of every country, and that's $10,244 per capita in 2018. And if you look at this graph here, here's the U.S. in green, and this is comparably wealthy countries. The next country under that is Switzerland, and it has 8,009, which is still significantly lower than the U.S. And then the average of the comparable countries is 5,280. So there's a huge discrepancy there between what the U.S. is spending and what comparably wealthy countries are spending on healthcare per capita. And then Taiwan has averaged $3,047 per capita in 2017, which would be even below what this chart indicates. So that Taiwan has a much more cost-effective healthcare system. So in terms of the ER visits per 100,000, the U.S. has 33,478 per 100,000 as of 2015. And Taiwan has 42,033 per 100,000 in 2014. So both of these are fairly high numbers, but Taiwan's is clearly higher. So excessive ER use is often indicating a lacking of primary healthcare providers or access to primary healthcare as people go for non-emergency situations. So as we'll see later, the U.S. and Taiwan both struggle in these measures. So in terms of public health and prevention, I chose to look at STD prevention. The U.S. spends about $16 billion annually on STD protection. And Healthy People 2020, which sets goals every few years for population health, set the goal to reduce every STD. And they're going to do that by increasing screening efforts and making treatment more accessible, treatment and counseling more accessible for people in high-risk groups. And just to compare the two countries, I looked at the new cases of HIV. In 2016, the U.S. had 1,182 per 100,000 population new cases of HIV. And that's compared to a much lower number in Taiwan of 8.45 per 100,000 new cases of HIV in 2018. So there's a huge difference there. And although that's only one STD, it does it does show a big difference in the public health and prevention measures in the countries. And in Taiwan, looking at different STDs, from 2005 to 2016, they had the rates of gonorrhea and syphilis were both increasing, but since then they've been able to curb that and reduce the rates. And congenital syphilis has also been decreasing and is on its way to eradication in Taiwan. And the goals of the Taiwan Centers of Disease Control sort of are pretty similar to that of Healthy People 2020 in the U.S., and they aim to increase adolescent education and control STI rates in high-risk populations, one of which is adolescents. So to compare the physical environments of the U.S. and Taiwan, I looked at the air quality of both the countries. So, there's not like a single number for the whole country, but I did look at the capitals of both the countries. So in Washington, D.C., the capital of the U.S., the air quality in 2018 was always in the good range of the air quality index. So the air quality index is indicated here, and it basically looks at the particulate matter and pollution in the air and measures it on a scale from 0 to 500. So 0 is the best, and 0 to 50 is the good range, and then hazardous is up to 500. So in 2018, Washington, D.C. was always in the good range. It varied within that, but was always in the good range. And then, so comparing that to Taipei, which is Taiwan's capital, it was pretty consistently under 100, and in 2018 was always in the moderate range. So it is still considered healthy, but it is a higher measure of the particulates in the air, and is considered less healthy than the good range. So the U.S. since 1990 has been able to reduce emissions, and this was done with emission controls on vehicles and industries, investment in more alternative sources of energy that reduce emissions, and protection of national parks. So Taiwan does a little bit worse with this. There's a lot of areas with new industry that struggle with maintaining healthy air quality indexes, and it's often been over 100 in those new industry areas. So that's this orange here, so that means it's unhealthy for sensitive groups. But they have seen significant improvements from 2015 to 2017. So in general, it looks like the U.S. does have better air quality index, but this is, of course, a changing measure. So in terms of access to care, the U.S. has approximately 2.55 physicians per 1,000 total population, whereas Taiwan has 1.7 physicians per 1,000 total population. So the U.S. does fare a bit better in this measure, but they're both still pretty low numbers. And of those physicians for the U.S., 12% were family medicine and 2% were general practice. So that is what would be considered the primary care providers for people. Whereas in Taiwan, only 5% of physicians were in family medicine, so that primary care, and all the rest were specialists. So this number makes sense compared to Taiwan's ER visit rates, which were higher than the U.S. because there is a significant lack of primary care providers in Taiwan, and to a less severe degree, but also in the U.S. So I also looked at the social and economic environment by looking at the unemployment rate. The U.S. and Taiwan in February of 2019 had very similar unemployment rates. The U.S. was 3.8 and Taiwan was 3.71. So there's not a big distinction there, and I would say they have fairly similar economic environments. So to summarize the key takeaways of the differences between the U.S. and Taiwan in terms of their health programs, the U.S. has a combination of private insurance and government-funded insurance that does leave a significant portion of people uninsured, while Taiwan has publicly financed insurance that includes universal coverage. The U.S. spends $10,244 per capita, and Taiwan spends a much lower amount, $3,047 per capita. So Taiwan's health system is far more cost-effective. And the U.S. had 590 infant deaths per 100,000 live births compared to the lower number of 430 per 100,000 live births, which indicates that the U.S. does have worse population health than that of Taiwan. And finally, one area where the U.S. did have a slight edge over Taiwan was in the physicians per 1,000 at 2.55 compared to 1.77 in Taiwan. So in general, Taiwan does tend to have a better healthcare system and better outcomes, although there's some areas such as the physician rate and also air quality index that the U.S. does have an advantage. So thank you.